Every child is a different kind of flower, and all together make this world a beautiful garden. I am Sheryl Fernandes, a registered nurse practitioner currently doing my MSc in Childhood Nursing at STM University, Dharwad. I am delighted to be here today to tell you about how the health history is being collected in pediatrics. Pediatrics include patients from neonate to adolescent ranging from the age 0 to 16 years old. Identifying the age of the child is key in pediatric history. It has been split up as neonate less than 28 days, infant 1 to 12 months, toddler 1 to 3 years, preschooler 3 to 5 years, schooler 5 to 12 years and adolescents 13 to 16 years. So also, history taking is an art that requires the clinician to listen effectively to the complaints of the patients. It is the foundation on which the diagnosis of any clinical condition rests. Before starting, we'll know about some of the guidelines required during history collection. First and foremost, you should check the child's age as this information is key in determining what questions you'll need to ask and what areas you'll need to cover. The child is generally accompanied by a parent or a caretaker. In young children who do not know to speak, the history has been collected through parents. It is important to be aware that a parent with a sick young child may be anxious. When you take a history, be empathetic and try to build a rapport with the family as a whole. Some young children are shy and might be embarrassed to talk. It's important to be friendly and engage with them earlier. Observe how the child is playing and interacting with any siblings and their parents. Be playful with the child if appropriate, interact with the child and address your questions to them depending on the age groups. Be mindful to allow the child to take time to answer and do not interrupt. Negotiating both talking to the parents without the presence of the child and talking to the child alone requires tact and consideration. If your patient is a newborn, you need to congratulate the parents before you jump into the history. History is usually taken starting with the basic information. So, here I have a child with the parent as informant and we'll start with the identification data. Hello, good morning.
Very good morning, ma'am.
I am Sheryl Fernandes, a registered nurse practitioner, and today I will be taking the health history of your child. Is that okay with you?
Okay, ma'am.
Okay. Would you mind who's speaking?
Ma'am, I'm his mother.
Oh, great. So, what is his name?
Ma'am, his name is Siddharth.
Oh, great. He's a male baby.
Yes, ma'am.
How old is he and when was he born?
Ma'am, he was born on 8th June 2020 and he is 6 months.
Okay. What was his birth order?
Ma'am, he is my first child.
Oh, congratulations.
Thank you.
Okay. May I please have your address?
Yeah, ma'am. We live in Vidyagiri, Hubli.
Okay. That's great. Thank you. Therefore, I have a master named Siddharth of 6 months old who came along with his mother as informant. He was born on 8 June 2020 and he was very first child to his parents. He resides from Vidyanagar, Hubli. So, do you have any questions related to this one?
Nothing as such, ma'am.
Okay. Start with the open-ended questions to establish the reason or the reason why the parent brought the child to the hospital. It should include the child's primary concerns. It should be collected in old card method and recorded in chronological order. So, what's brought your child in today? How can I help you?
Well, ma'am, my child has fever and loose stool since 2 days and he has ache in his stomach also. He has become very weak and not active in his behavior, ma'am.
Okay. Can you point to where the child experiences the pain?
Ma'am, he cries when I palpate over his stomach.
Okay. How long has he been experiencing the pain?
Ma'am, he'll be constantly crying.
Okay. Is the pain constant or it is like coming and going?
It is constant, ma'am.
Okay. Does he cry when you hold any other body parts?
No, ma'am.
Okay. Okay. Are there any symptoms that seem associated with the pain?
Ma'am, he feels past tools.
Okay. Does anything make the pain better?
Yeah, ma'am, I had given him some home remedies to reduce the pain.
So, my client, Master Siddharth, was brought to the hospital with the complaints of fever since 2 days, loose stool since 2 days, ache in the stomach since 2 days, and also his mother complains of inactive behavior. So, I hope this explains the situation of your child. Is that okay with you?
Yes, ma'am, this will be fine.
Okay, thank you.
Yes.
So, let's move on to history of present illness. History of present illness gives a detailed account of onset, progression and duration of various complaints in order to their appearance. Medical terminologies should be used to describe the history of presenting illness. For instance, my client Master Siddharth was apparently alright since 2 days back and then he suddenly developed fever and loose stools. His mother also complains of the aching stomach and also inactive misbehavior. My client has no history of any respiratory illness, no history of oliguria, no history of common cold or dyspnea. Is there anything that I have overlooked?
No, ma'am.
Okay. Now, we'll see how past history is being taken. Was your child hospitalized before for any illness?
No, ma'am.
If the child does have a medical condition, you should gather more details to assess how well controlled the disease is and what treatment the child was receiving. It is also important to ask about the complications associated with the condition, including hospital admissions. Now we'll know about the past surgical history of the child. Has your child undergone any procedures or any operations previously?
No, ma'am.
Okay. If so, then ask the complete details about the surgery, like when was the operation or any procedures underwent and why was it performed, and also ask about the treatment modalities. So, is your child allergic to something?
Yes, ma'am. He's having diaper rashes.
Okay. So, my client, Master Siddharth's mother, says that he has no history of hospitalization and also he has never underwent any surgeries before. But he was allergic to diaper rashes, which was then relieved by treatment. Oh, he started to cry.
Yeah.
You can take this.
Thank you.
Okay, is there anything to add in it?
No, ma'am.
Okay, thank you. Now let's begin with family history. You belong to a nuclear family or a joint family?
Ma'am, I belong to a nuclear family.
Okay. How many members do you have in your family?
Ma'am, we are 3 members.
Okay, fine. What's the age of you and your spouse?
Ma'am, I'm 25 years old and my husband is 30 years old.
Okay. Have you married to any of your relatives from same ancestors?
No.
Has anyone at your household has medical issue?
No, ma'am, not at all.
Do you have any history of hereditary, like congenital or any disabilities at your family?
No, ma'am, there is no any issues.
Is there any condition which appears same at your family?
No, ma'am.
My client, Master Siddharth, belongs to a nuclear family. His father, who is 30 years old, and mother, 25 years old, have non-consanguineous marriage and there is no any hereditary, congenital or any disabilities present in their family. On basis of information given by the informant, let's now formulate the family tree. Client's father, client's mother, and baby has a client. So now let's know the socio-environmental history. So, what type of accommodation the child is living in?
Ma'am, we live in RCC type.
Okay. What's the education of the you and your spouse?
Ma'am, I'm BA graduate and my husband has completed BE.
Okay. What do you do for your living?
Currently, housewife, ma'am, and my husband works as an engineer.
What's your income of the family?
It is 40,000 per month, ma'am.
And what's the source of the water that you use?
Ma'am, it's tap water.
Is the surroundings of the home kept clean?
Yes, ma'am, it is very clean.
So, my client, Master Siddharth's mother, assured that she lives in an RCC type house along with his father and mother. His father works as an engineer and his mother is a housewife. Their family income is 40,000 per month. They use tap water for the daily routine and have maintained clean environment. Now we'll know about the birth history. Birth history includes antenatal history, natal history and also the postnatal history. So now we'll move to antenatal history. Is that okay with you?
Yes, ma'am.
Okay. What was your age at delivery?
Ma'am, I was 25 years old.
Okay. Were you updated with immunization schedule?
Yes, ma'am. I had taken 2 doses of TB in early pregnancy.
Were there any obstetric problems including abnormal scans or abnormal clearing tests?
No, ma'am.
Okay. Was there the history of any abortions previously?
No, ma'am.
Have you taken medications during pregnancy?
Yes, ma'am. My physician has advised iron and folic tablets.
Okay. So, Siddharth's mother was 25 years old when she delivered and she had taken TT vaccines early in pregnancy. She also took iron and folic acid tablets during pregnancy. She underwent scans regularly and had no complications. Now let's know about the natal history. Whether you underwent a normal delivery or C-section delivery?
I had a normal delivery.
Okay, that's fine. At what gestational age did you deliver and what was the baby birth weight?
I delivered Siddharth at 8 months, ma'am. And his birth weight was 3.5 kg.
Okay. Were there any concerns during delivery?
No, ma'am.
Was the baby stable at birth?
Yes, ma'am. It was a very beautiful moment when I heard his first cry. He was crying very loudly. He was pink in color and active in nature.
So, my client, Master Siddharth's mother, had a normal vaginal delivery with no intervention at the 8th week of gestation. The birth weight of the newborn baby was 3.5 kg. He cried immediately after the birth and was pinkish in color and active in nature. We'll also know about the postnatal history. Were there any congenital abnormalities at the birth of the baby?
No, ma'am. He was born normal with no abnormality.
When was the baby breastfed after delivery?
I breastfed him after half an hour of delivery.
Did the child require admission to any special care facility like NICU?
Yes, ma'am. His bilirubin levels were high and physician told that 1 day stay in NICU is required.
Okay. Did the baby pass stool within 24 hours?
Yes, ma'am.
My client's mother says that he was born without any congenital abnormalities and was breastfed within 24 hours of birth. He also passed meconium and he was shifted to NICU as his bilirubin levels were increased. Developmental history. Developmental history is an important key to know as it shows whether the child is attaining all the milestones in life or there is a delay in development. The sequence goes like gross motor, fine motor and vision, speech and hearing, and also social. This will vary from each child at different age groups. So, now let's know about the developmental history of Siddharth. So, did he try to roll front and back?
Yes, ma'am. He's trying to roll.
Yeah, okay. Does he try to hold the objects?
Yes, ma'am. He grasps toys.
Okay, that's excellent. Is he trying to sit without support?
Yeah, nowadays he's sitting firmly, but he needs some assistance.
Okay. Does he recognize your voice?
Yeah, me and my husband's voice needed.
That's good. Does he try to make some songs?
Yeah, it would be like screaming cool like that.
Oh. According to his mother's assurance, my client, Master Siddharth, has attained all his milestones up to date, as he started to roll back and forth and was able to grab and shake the toys. He also started to sit firmly with some assistance. He could also recognize familiar voices from his family members. So, further moving to nutritional history. May I know about your dietary pattern?
Yes, ma'am.
Thank you. So, what type of diet your family prefers?
We prefer mixed diet.
Oh, that's good. Are you sufficiently breastfeeding your baby?
Yes, ma'am, I am.
That's good. Have you started any diet plan for your baby?
Ma'am, currently I am breastfeeding the baby, but I've thought of starting some diet.
Master Siddharth's mother says that they prefer mixed dietary pattern. She breastfeeds her baby sufficiently and also has started weaning for the baby. Lastly, moving with immunization history. Is the child up to date with his immunizations?
Yes, ma'am, he is, and I have the record too.
Okay, can I check it once?
Yeah, ma'am.
Thank you. Well, that's great. Your baby is up to date for immunization.
Thank you, ma'am.
So, Master Siddharth has taken up-to-date vaccines till date, which includes at birth he was being administered BCG, OPV and hepatitis B with vitamin B. He also has taken second dose of OPV and hepatitis B at 6 weeks. Thank you for your cooperation.
That's okay, ma'am.
Every child is beautiful, unique and different, and he responds in his own way. History collection in childhood nursing is an art. Proper skills and techniques should be used as it helps to rule out the clinical condition of the child. By this, I conclude history collection in childhood nursing.